The safety of all members of the MSVU community is of utmost importance. As we gradually increase our on-campus operations, we want to be sure that you have the information you need to protect yourself and those around you. In this video, we will describe the steps taken by the university to protect you and the steps you can take to protect yourself and others. While working from home remains our focus to the greatest extent possible, our fall operation plan allows for increased but still limited campus access. Campus access requires prior approval. An access request form will be available on the website. COVID-19 is caused by a novel coronavirus, SARS-CoV-2. Human coronaviruses cause infections of the nose, throat, and lungs. They are most commonly spread from an infected person through respiratory droplets generated when you cough or sneeze, close prolonged personal contact such as touching or shaking hands, touching something with the virus on it, then touching your mouth, nose, or eyes before washing your hands. COVID-19 was declared a global pandemic in March 2020. Symptoms of COVID-19 can take up to 14 days to appear and can vary from person to person, with some people experiencing no symptoms at all or very mild symptoms. The more commonly reported symptoms include new or worsening cough, shortness of breath or difficulty breathing, temperature equal to or above 38 degrees Celsius, feeling feverish, chills, fatigue or weakness, muscle or body aches, new loss of smell or taste, headache, gastrointestinal symptoms including abdominal pain, diarrhea, vomiting, and feeling very unwell. The most effective means of preventing exposure to COVID-19 is through elimination. This includes working remotely, so if you can continue to work remotely, please do so. The next level is engineering controls which separate you from the hazard. This includes physical barriers. The next level down is administrative controls, which includes staggering office hours, reducing the number of people in the workplace, signage, enforcing hand hygiene, and cleaning protocols. The last line of defense is personal protective equipment, or PPE. PPE protects people when physical distancing, physical barriers, and administrative controls are not possible. All those coming on campus are reminded to adhere to the following protocols. Practice physical distancing, keeping a distance of at least 6 feet or 2 meters between individuals. Cover coughs and sneezes with a tissue ideally, or your elbow. Avoid touching your mouth, nose, and eyes. Wear a face covering, and ensure frequent hand washing or use hand sanitizer. Frequent hand washing helps to reduce the spread of COVID-19. Washing your hands with soap and water is best. Rubbing your hands together when you wash them removes visible dirt and germs. Dry your hands with paper towel and use paper towel to turn off the tap. When you are unable to wash your hands with soap and water, use hand sanitizer. Non-medical masks or face coverings are required in indoor common areas at MSVU. You are encouraged to bring your own mask to campus. A limited supply is available for those who do not have their own. Remember, Nova Scotia Public Health may change directives at any time, so please be aware that messaging from the university may change in response. Before coming to campus, you need to check with your supervisor that it is okay to do so. If you are approved to come to campus, you must complete a health self-assessment before doing so. If you have any symptoms of COVID-19 or are feeling unwell, don't come in. Have you traveled recently? If so, be sure you are following current COVID-19 related travel advisories, including the requirement to self-isolate for 14 days if you are arriving in Nova Scotia from certain destinations. Have you come in close contact with someone confirmed to have or suspected of having COVID-19? Or are you awaiting COVID-19 test results for yourself? If so, you are required to self-isolate and therefore shouldn't be coming to campus. please review Nova Scotia's self-isolation guidelines available on the provincial government website at novascotia.ca/coronavirus. As always, if you develop any symptoms of COVID-19 before or after coming to campus, call 811 for guidance. As you return to campus, you will notice many changes to how you get around, enter and exit meeting rooms and classrooms, where you can sit, floor markings and signage, and occupancy limits. With all of these changes, it's important to remember that we respect the accessibility needs of others. For example, some people may need to wear different personal protective equipment than you do or use alternate access points. Inside buildings, there may be new directional requirements for you to follow. Some buildings, classrooms, and meeting rooms may require you to go in one door and out another. Certain regular entrances may be off limits. In narrower corridors, one-way traffic flow will be required. Wherever directional requirements are in place, these will be marked. As well, floor markings will indicate physical distancing for queuing, for example, to enter a room. Though the risk of transmission while passing people in wide corridors is low, please do not stop and chat with people along the way. Classrooms, meeting rooms, and offices will have greatly reduced occupancy limits. These limits will be posted. As well, public health directives on gathering limits must be adhered to at all times. Washrooms and elevators may have room for only 1 or 2 people, so please be patient. Furniture throughout campus may be arranged or blocked to adhere to occupancy limits and physical distancing requirements. Please follow all instructions and signage. To help ensure your safety on campus, there is ongoing, daily enhanced cleaning of common high-touch surfaces such as door handles and elevator buttons. We must all do our part to reduce risk, but we cannot eliminate it completely. By following the precautions outlined in this video, you are helping to protect yourself and others. Remember, keep a distance of 2 meters or 6 feet between yourself and others. Wear a mask. Wash your hands often or use hand sanitizer. Follow directional signage, adhere to gathering limits, and stay home if you're sick. Thank you for taking the time to review this important information.